If you've been anywhere since the end of September, you probably noticed pink ribbons everywhere inside the store windows, cars, t-shirts, purses, earrings, anything imaginable, pink ribbons out there. That's because October is the National Breast Cancer Awareness Month. National Breast Cancer Awareness Month started in October 1986. So what is breast cancer? Breast cancer is a malignant tumor inside of the breast. What happens is a mutation occurs, and the mutation attacks the cell, and those cells begin to attack other healthy cells. So who's at risk for breast cancer? Of course, women are more likely to get breast cancer, although some men do get breast cancer. Race does play a factor. Caucasian women over the age of 55 are more likely to get it, but breast cancer between the ages of 14 to 45 is more common in African American women. Most breast cancer cases occur in women over the age of 55. 2/3 of all invasive breast cancer cases women over the age of 55. Smoking plays a factor, lack of exercise, history of cancer in the family, not necessarily breast cancer, but cancer in the family in general does leave you more open to having breast cancer. Types of breast cancer: ductal carcinoma in situ. That is when the cancer hasn't left, it hasn't invaded into the tissue, and if it's treated early enough, it doesn't necessarily become cancerous. Invasive ductal carcinoma means it has already left and has spread to the tissue, and this is the most common type of breast cancer. 8 to 10 cases of invasive breast cancer is the invasive ductal carcinoma. The least known kind is inflammatory breast cancer. It's only like 2 to 3% of breast cancer cases. This is just like an inflammation of the breast. The skin becomes kind of big and pitted. Diagnosis: mammograms is the way they're diagnosed. MRIs, clinical breast exams. With the mammograms, you go in and they place the breast in between the plate and press down and it takes the image. With the clinical exams, a nurse or a doctor, they check to see if the breast size has changed or if the breast is shaped kind of odd. Then they do they use their fingers and they touch around and feel for the lump. And then the MRI is when you lay face down on the platform and the breast, there's an opening for the breast, and the MRI machine will scan the breast and see if there's a tumor inside. Statistics. Breast cancer is the leading cause of cancer deaths in women from ages 15 to 54. In women over 55, it's the second leading cause. It's only beat by lung cancer. 89% of women who are diagnosed with breast cancer will live 5 years later to tell their story. And if it's caught early, 98% of the women live. In 2011, there will be over 280,000 new cases of breast cancer, 40,000 deaths. But right now, there are over 2 million women living in the U.S. who are survivors of breast cancer treatment. Some women have, if they want to save the breast, they can either have a lumpectomy or a quadrectomy. But if not, they have a mastectomy. The lumpectomy means they only take out the lump and a little bit of tissue surrounding the lump. The quadrectomy means they take out 1/4 of the breast. But with the mastectomy, they take the whole entire breast. And they do that if the cancer has spread so far they cannot save the breast. With the lumpectomy or the quadrectomy, it's like a two-week healing period. With the mastectomy, like 4 weeks, and then women are back up and able to function as normal. Support for breast cancer, of course, we know about the American Cancer Society, the Susan G. Komen Society. Susan G. Komen Breast Cancer Foundation was founded in 1982 by Nancy Brinker and her sister Susan G. Komen, who died at 36 from breast cancer. The Susan G. Komen Foundation raises millions of dollars for research. They do different fundraisers. People race for the cure. You've seen them racing for the cure, raising money throughout the month of October, but it's year-round. They do research and funding year-round. The American Cancer Society, you can go on the website. They do pamphlets, everything you need to give you information about the disease. Although breast cancer is a scary thing, just because women are diagnosed with breast cancer does not mean they would die. The research right now, with most women with breast cancer survive to tell their story. So in conclusion, yes, breast cancer is present, but if you fight it, early detection, mammograms, checkups, just going to see a physician regularly can get it diagnosed early and therefore treated so it doesn't have to be a terminal illness. Thanks.